Welcome to Canadian Justice. I'm Christine Van Gyn, and today we're talking about life after COVID and what comes next for Canada. I've joined with several other organizations to publish a new book on this topic. It's called Life After COVID. The book examines the legal and public policy challenges that COVID has presented to governments and to individuals. How COVID has impacted our individual liberties, our democratic rights, government spending, and our government-run healthcare system. The book initiative was launched by Second Street, a charity that tells the stories of ordinary Canadians and their families and how public policy choices harm or help their prosperity, freedom, and lives. The book was contributed to by Anthony Furey from the Toronto Sun and authors from the Canadian Constitution Foundation, the Canadian Taxpayers Federation, the Justice Centre for Constitutional Freedoms, and the Montreal Economic Institute. We're going to be joined from authors from these different organizations to talk about the new book. And as a special treat for our Canadian Justice viewers, you can get a free copy of this book as an ebook by visiting the ccf.ca/lifeaftercovid. Now, let's chat first with co-authors Colin Craig and Anthony Furey. Thank you both so much for joining me today. Colin, can you tell me why you decided to start this initiative to write a book about COVID? What inspired you?
Well, Christine, once we get COVID under control as a country and we're all able to take off our masks and celebrate, politicians are going to have a lot of work ahead of them. There are a lot of very serious problems in this country that arose in large part because of COVID, but some were kind of bubbling below the surface beforehand. So you look at our healthcare system as an example. Patient suffering has never been higher. Waiting lists are off the charts. Governments postponed hundreds of thousands of surgeries during COVID. You look at government finances. The federal debt's well over $1 trillion now. Just a little over a year ago, that was unimaginable that we would reach that point. You look at the unemployment rate. It's pretty high. Lots of people have lost their jobs. So those were some of the big picture problems that we're looking at coming out of COVID. There's also a need, I think, to look at what happened during COVID. Things like how our rights were infringed upon. In some cases, I think, they're probably pretty reasonable. In some cases, I think governments went beyond what was reasonable. So that was important to review that. Review how government sidestepped democratic processes during COVID. And also look at how in many respects, and Anthony will talk to this, they ignored their emergency plans. So you had all these problems, and I thought, it'd be great to put together a free ebook so that the public can learn more about these issues, but then also so that we could put forward some constructive ideas for politicians so that ultimately Canada can start to go in the right direction when we come out of this.
Now, Anthony, I loved your chapter. You focused on how the governments across Canada and federally have basically abandoned their pandemic plan that they had in place as this pandemic has evolved. Can you tell me a bit about that chapter you've written?
Yeah, thanks, Christina. I didn't love the chapter. I find it a maddening experience because when you actually read these plans that the federal government, all of the provinces, and even some regional health networks across the country, they all actually have robust pandemic preparedness plans where they talk about what they're supposed to do in the event of, what's going on right now in Canada. The federal one was signed off by Dr. Theresa Tam back in 2018, and they talk about a much more balanced approach that we're currently experiencing here in Canada and have done throughout the past 14 months. They take the virus that arises very seriously in the plans. They do presuppose more people actually get sick than what has happened so far in Canada. They presuppose that hospital ICU rates will be higher, much higher than they've even been so far here in Canada, but they do not advocate broad-based lockdowns. They talk about ways to support the hospital systems to minimize illnesses among Canadians, but to also protect society in a way so that it can continue functioning, so that there are contingency plans basically for all operations, so you can still let life continue. It's a very enlightening, but like I said, a maddening experience to read that all along there was a better way, a better plan that they had.
It really struck me that they completely abandoned these plans and that lockdowns weren't really a part of it. In just 10 seconds before we go to commercial, how do you think we can get back to those plans? Is it even possible?
Well, right now it does seem like there's widespread public support to some degree for this. So I think it's really just about spreading the news and talking about what's in these plans and how these aren't things that I made up. They're things that Dr. Teresa Tam made up.
Yeah, I was surprised when I read your chapter and learned that they had this plan that they completely abandoned. We're going to get back into examining exactly why that happened after these commercial messages. Welcome back to Canadian Justice, where I'm talking to some of my co-authors of the new ebook, Life After COVID. Now, Anthony, what really struck me in your chapter is that the existing pandemic plans did not contemplate lockdowns. So where did this idea come from?
Well, that's a really good question because really no public health academic or anybody practicing it has ever talked about widespread lockdowns before. It all started, of course, in Wuhan, China. Then it moved to Italy and it became a cascading effect. It became a thing to do. And actually, when it first started happening in Wuhan, initially there were people all across North America, public health experts, who were denouncing it and saying that is not in our protocols. But they eventually came to accept it, even though it goes against the plans that they had documented for many years beforehand.
Now, is there an off-ramp for this policy to sort of how are governments going to make the decision about when this ends if it was never in their original plan?
That's a very good point. And no, there are not really exit strategies that have been articulated. Different jurisdictions have different attitudes towards it, different metrics towards what classifies ending a lockdown or ending this or that restriction. And when you press a lot of governments about these specific plans, I can tell you from where I am in Ontario, the answer is just no, they don't have it. And one thing that's been so frustrating for so many people is the goalposts do continually shift. You know, that line that's now just become an old joke that's sort of, oh, we're in week 60 of 2 weeks to flatten the curve.
Yeah, absolutely. Now, shifting gears, Colin, I want to talk about your chapter, which is about economic growth through less government as a way of getting out of some of the economic consequences this pandemic has had. You open your chapter by saying, when politicians don't know what to do about a problem, they reach into your wallet and announce new funding for a government program. And I think that this is such an acute observation about the government response to COVID. Can you give me a few examples of where this has happened in the current response?
Well, we saw it most recently with the federal budget. The government's looking at spending well over $100 billion to try to stimulate the economy. And we've seen this other times in the past where governments, you reach a sort of a low period in the economic cycle, and then governments say, well, we've got to spend money to get the economy going. But what we tried to do in that chapter is show that governments can get the economy going, not by spending money, but by getting out of the way. So often governments, through their rigid policies and processes, grind down the processes which allow business activity to flourish. So if governments would just make it easier for entrepreneurs to start selling their products, making their products, and so forth, then that's how you can get the economy going, get businesses starting up, creating jobs, expanding, and so forth. And so we look at a whole bunch of different areas in the chapter at ways governments can do just that.
Yeah, that was one of my favorite parts of your chapter was all of the examples you had for better ways to stimulate the economy following this pandemic that involved less government rather than more. Can you give me a few examples of where that would be possible?
Well, I'll give you a good example from the pandemic itself. When the pandemic arose, governments across the country, they shut down restaurants. But at the same time, they recognize that if they do that, it could drive a lot of those businesses under because they're then having to rely on just sales from pickup and delivery orders. So one thing governments did is they started to allow across the country consumers to start ordering alcohol with their takeout and delivery orders. And lo and behold, it helped. We saw lots of stories. We talked to businesses and pubs and so forth where that little bit of extra money allowed them to maybe hire a worker back or keep a worker employed or two or three or whatever, pay for heating, electricity bills, whatever. So that was just one small thing governments did to help those businesses stay afloat. And there's lots of examples like that across Canada. The Canadian Federation of Independent Business has estimated that unnecessary red tape and regulations cost businesses $10 billion a year. So if we could just cut all those unnecessary regulations, then we could unleash $10 billion in economic activity. That's just one example. There's all kinds of other different ways that governments are holding back our economy. You look at the natural resource sector, there are huge, huge projects in the oil and gas and mining sector where they haven't moved ahead because governments have ground those projects to a halt. There's billions of dollars of opportunity there if we could start to get more projects to yes, rather than putting up these roadblocks all the time. It's also hard for businesses to deal with each other in other parts of the country. So often, instead of looking to do business with the business in another part of the country, they'll look to the United States and expand there because it's easier. So if we cut down what they call interprovincial trade barriers, get those rigid government regulations out of the way there, we could create even more billions of dollars worth of economic activity. So all these examples have one thing in common, and that's less government, and you can end up doing it without having to spend taxpayers' dollars.
Welcome back to Canadian Justice, where we're talking about the new book, Life After COVID, and I'm chatting with some of my co-authors. We're joined now by Franco Terzano from the Canadian Taxpayers Federation and by Crystal Wittengravel from the Montreal Economic Institute to talk about their chapters in this book. Now, Franco, you've written a chapter on Canada's post-COVID finances. What's your biggest concern about government spending during COVID and in the post-COVID era?
Well, I think all Canadians need to be worried about government debt right now. The federal government is already more than $1 trillion in debt. You break that down, that's more than $28,000 per Canadian that we owe in federal government debt alone. So I don't think we should kid ourselves here. If the feds don't rein in spending, taxpayers are going to get walloped. And on top of that debt, the government also has to pay interest charges. Over the next 5 years, interest charges on the debt are going to be about $150 billion. And you know what? That money isn't going to government services. It's not going to healthcare. It's not going back into your pockets through lower taxes, because that money is going to the bond fund managers on Bay Street to service the government's debt.
Yeah, so speaking of healthcare, it's an area that Crystal's written her chapter about Canada's current healthcare system and healthcare reform. Now, Crystal, you talk about how Canada's healthcare system was underperforming even before COVID-19. Can you give me a few examples of that underperformance?
Well, absolutely. It's become abundantly clear the problems with our system. So if we look at it, I'm sure most of us here know somebody or ourselves have been on extremely long wait lists for any sort of procedure, medically necessary surgery. It's translated into astronomical waits for folks. We have huge capacity issues, which can be reflected in other areas like overcrowding in hospitals, which was a huge issue prior to COVID. So a CBC News analysis of about 170 Ontario hospitals that was published just before the very first COVID case was here in Canada reported that in the preceding 6 months, nearly half of the hospitals were beyond capacity for more than 30 days. So that was before COVID had even arrived in Canada. This is not a new issue. Our capacity issues run very, very deep in this country.
And Crystal, the chapter goes on to talk about a few ways we can reform healthcare, because it's certainly become even worse. Speaking of people who've been on wait lists, I have friends who have had their cancer treatments delayed in Ontario as a result of the pandemic and the crisis in healthcare that predated this pandemic. Can you talk about how reforms could improve that situation?
Absolutely. So currently, hospital systems, for example, are funded under global budgets, which really leaves no room for incentive to the hospitals to find any sort of efficiencies. They are funded based on previous year's activity. So there's no built-in incentive to try to be better, do better, or innovate in any way. We can also find better efficiencies and better provision with utilizing some of our other healthcare workers. So, for example, nurses and pharmacists, we've seen here, even just recently, expanding their scope or utilizing them to their full scope, rather, in the vaccination campaigns has resulted in huge capacity boosts. So just acknowledging some of these things, using the resources that we do have. Again, telemedicine is another great example. It utilizes current resources in a better way, finding those efficiencies that already somewhat exist.
Now, Franco, one of your concerns you've expressed is that the more debt we take on, the more money we need to spend servicing that debt, and the less money we have for services like Crystal's talking about, like healthcare. But once governments start spending on something, on some of these new programs, it's really hard to get them to end the program. And there have been a lot of emergency programs brought into place during this pandemic. How hard is it going to be to end those programs?
Well, keeping the temporary spending temporary is going to be a key thing for this federal government to do to make our way back to fiscal sanity. And one thing that we have to remember here is that we were overspending before the pandemic. Remember, even before COVID-19, Prime Minister Justin Trudeau told us he was going to balance the budget. Well, guess what? He missed that target by a country mile. So we were overspending before COVID-19. And unfortunately, we see this recent budget from the federal government continue down that path of more overspending. You know, one of the big issues that we see concern with is that Finance Minister Freeland is going to be increasing permanent government spending by about $100 billion by 2026. That's permanent government spending going up. And guess what? The Trudeau government was not a bunch of penny pinchers before COVID-19.
We're going to get back into this conversation after these commercial messages. Welcome back to Canadian Justice, where we're talking about the new book, Life After COVID, and I'm joined by two of my co-authors, Crystal and Franco. Now, Crystal, I want to turn to you on your chapter on the healthcare system. Why isn't just throwing money at the system, cover your ears, Franco, why isn't throwing money at the system going to solve the problem?
Well, we've been doing it. I mean, we've historically been throwing money into our healthcare systems provincially all over the country for years and years and years. This has not resulted in better outcomes. We do not have near the same amount of hospital beds or other medical technologies as other industrialized countries. Our wait lists are still astronomical. There's something seriously wrong structurally. It's not a matter of throwing more money at it anymore. We can't turn a blind eye to this any further.
So you've talked about some reforms, Crystal. Have any of those reforms already started? I know my organization, the Canadian Constitution Foundation, is involved in an important case out in British Columbia related to healthcare choice and healthcare entrepreneurship. Are there any other changes to the healthcare system that have already started during COVID?
Well, we've seen the use of telemedicine has been liberalized, and most provinces, to my knowledge, are currently using it under the state of emergency. Alberta, for example, has committed to keeping telemedicine permanently post-crisis. So that's definitely somewhere that other provinces could easily follow suit. It's a thing where now it strikes me as so silly that we weren't doing this before. But it's really opened up the doors for something like telemedicine, for example.
Yeah, some great suggestions for reforms in that chapter. Now, Franco, I want to turn to you. What are some ways that the government can stimulate the economy without adding to the debt?
Well, the big thing that we do not want to see is more corporate welfare, right? Especially after we've seen the Fed spend billions of dollars during 2020, during the pandemic. I mean, we don't need any more so-called economic stimulus spending, right? These politicians in Ottawa, they couldn't even balance the budget of a lemonade stand. So we definitely don't need to be seeing them running around playing investment banker with our tax dollars. Instead, they should be keeping more money in the pockets of families so that we can spend at our local shops. They should be reducing taxes for businesses so they have more money to reinvest in their operations to help get their workers back employed. And you know what? Prime Minister Justin Trudeau, he promised not to raise taxes, but despite that promise, we've seen the carbon tax go up twice. We've seen booze taxes go up. So we need to see the opposite. We need to see the feds reduce taxes and keep more money in our pockets.
Franco, your chapter is also filled with examples of government waste that we could end right now, which can make economic recovery quicker and easier. Can you give me a few examples of some of that waste?
Well, when we're talking about savings, we need to see leadership at the top, right? We need to see our members of parliament show solidarity with struggling taxpayers and take a pay cut. But in fact, we've seen our MPs rake in 2 pay raises during COVID-19. Talk about a slap in the face to so many Canadians who took a pay cut, who lost their job, maybe lost their business. The next thing that we need to see is our bureaucrats willing to share in the tough times, but we really haven't seen that. And research from secondstreet.org shows us that the feds actually have no records of their unionized employees ever receiving a pay cut.
Some really interesting ideas in that chapter. I suggest everyone check it out. Thanks so much for joining me. Today we've heard from the authors of a new book called Life After COVID, but I left out one chapter, and that's mine. I've written a chapter about the impact COVID has had on our fundamental freedoms and individual liberties. My chapter describes the numerous court challenges to government policies that have gone too far and describes what we can do as citizens to push back. I'd like to offer this book for free to all Canadian Justice viewers, and you can visit theccf.ca/lifeaftercovid to get a free copy of the book for a limited time as a thank you for watching the show. And I'd love to hear what you think. You can tweet your thoughts about the book to @CVanGuyn. I would love to hear your feedback. That's all for today's episode. I'm Christine Van Guyn, and remember, a freer Canada starts with you.